Welcome back, class. Today we're going to talk about caring for the patient on psychotropic medications. My name is Catherine Nippers, and let's go ahead and get started. All right, the goal of today's presentation is to provide undergraduate nursing students with knowledge of the clinical indications, usage, and side effects of psychotropic medications. Our objectives here, we're going to compare and contrast different psychotropic medications. We're going to apply knowledge of psychotropic medications to nursing practice, and we're going to explain indications for usage of psychotropic medications. Last week, we talked about different psychiatric disorders. We talked about schizophrenia, bipolar, anxiety, and depression. So those disorders are going to be incorporated into our lesson today because we're talking about the different medications that are used to treat these. Psychotropic medications are defined as drugs that have an effect on the chemical makeup of the brain and nervous system, and they're used to treat mental illness. Antipsychotics are used to treat schizophrenia and mania. We've got two categories. We have the first one, which is typical antipsychotics. These are older, developed around the 1950s, and they're more likely to cause side effects, and this includes your Haldol, your Prolixin, your Thorazine, drugs like that. Then we have your atypical antipsychotics. Those are your newer drugs, and these are less likely to cause side effects. And these include Clozaril, Risperdal, and Seroquel. The one I'm going to go in more detail about today is Clozaril, because that's one of the medications that we talk about today that has a bunch of clinical indications for. Clozaril, like I said, is an atypical antipsychotic. With Clozaril, we want to use it only when all other options have been exhausted. So when we've used Risperdal, when we've used Zyprexa, those kind of drugs, and nothing has happened regarding the patient's well-being, nothing has improved with the voices or anything like that, we're going to start them on Clozaril. With Clozaril, initially you need to get a CBC. You need to monitor the absolute neutrophil count, or ANC, as well as the white blood cells, because those are the values that are affected when someone's on Clozaril therapy. The white blood cells drop, the ANC drops, and that patient is more susceptible to infection. Also, when someone's on Clozaril, we titrate the dosage. When we start a patient on Clozaril, we give them a very small dose initially to kind of see how they react. So if we give them like a 12.5 milligram dose of Clozaril, we monitor how they are. We get their vital signs the first 4 hours after we give them this test dose. And if we see anything abnormal, we just stop it and we try to start something else. Then, if it goes well, we just continue with the treatment. Eventually, we're going to titrate up that Clozaril to being twice a day. The adverse effects of Clozaril include drooling, sedation, and low neutrophil count, like I mentioned before. Mood stabilizers, we have lithium and Depakote are the main ones. Both of these are used in the treatment of bipolar disorder. The main one I'm going to talk about today is lithium, because that is the one that has more clinical indications with it, so more things we have to monitor with it. Depakote, we mostly get a Depakote level. We check it about weekly to see where our levels are. Lithium, like I said before, is used to treat bipolar disorder. We monitor lithium with lab work. Our important thing with this patient, educating that patient, is to limit salt intake. So no extra salt packets on their food. They can use salt alternatives, but they don't need to use salt, because that will end up increasing their levels. They'll end up developing edema as a result of it. Tremor also occurs with lithium, as well as decreased thyroid function, so we need to monitor their thyroid levels as well. Antidepressants are used to treat depression. We've got our tricyclic antidepressants. That includes Elavil. Our SSRIs are selective serotonin reuptake inhibitors, and that includes Celexa and Lexapro, drugs of that sort. MAOIs are monoamine oxidase inhibitors, and that one includes Nardil. The MAOIs are relatively old drugs, so they they were developed before the SSRIs and things of that sort. So these drugs have a lot of side effects associated with them, and they have certain dietary restrictions. I believe you can't eat certain cheeses or drink wine or anything while you're on an MAOI. SSRIs have relatively low side effects, and they're often the first line to treat depression. Anti-anxiety meds, they do exactly what they say. They treat anxiety. We've got your Ativan and Klonopin. Those are more addictive drugs that are used to treat anxiety. We also have Buspar, which is a less addictive option to treat anxiety. So Buspar works very well. We see it used a lot. Another interesting fact is atenolol in low doses has been shown to decrease anxiety, and that's just interesting because that's normally a blood pressure pill. One rare complication of antipsychotropic medications is neuroleptic malignant syndrome. Signs and symptoms of this are muscle rigidity, high fever, changes in mental status, and autonomic dysfunction. This develops over 1 to 3 days, and it can develop at any time during the treatment with psychotropic medications. So you have to monitor that patient the entire time they are on this medication to see if they develop this. Treatment for NMS includes withdrawal from the psychotropic drugs, reduction of body temperature, and rehydration. So the main thing that we need to watch out for this, the key indicator from a nursing standpoint, is as soon as we see that high fever and muscle rigidity, that's when we need to call the doctor and get that patient in for some treatment. Tardive dyskinesia is another complication from antipsychotic medications. Tardive dyskinesia is permanent. It's abnormal body movements from different parts of the body. Got your mouth movements, your lip puckering, lip smacking, tongue rolling, frowning, things like that. And then you have rapid movements of the body in the arms, legs, and trunk. And then you have the face that can sometimes have facial drooping or eye drooping. And then the eyes may rapidly blink. For other symptoms, you have the difficulty breathing, difficulty swallowing, and difficulty speaking. So it is very important to watch out for this because this is more common with someone who's on older antipsychotics, but it can still happen to anybody, and it's important to watch out for it because it is permanent and it does affect the quality of life of the patient. Ames test. So to record the occurrence of tardive dyskinesia, we use the Ames test, and it stands for Abnormal Involuntary Movement Scale. So this kind of rates the severity of the movements on a scale from 0 to 4. I'm going to pass out a handout that shows the scale, and when I pass that out, we're going to do a little exercise. We're going to perform the Ames test with a classmate. So I'm just going to go over this handout with you guys. We have, just like I said, we have the 0, which is no movement, and it goes from 0 to 4. 4 is severe. And then we have the different categories. We have your facial and oral movements, extremity movements, trunk movements, global judgment, and dental status. So this is just your typical Ames test that we see in the hospital. Now I'm going to pass that out to you guys, and then we're going to get into groups and we're going to do the Ames test together, okay? All right. So basically I'm going to go over the Ames procedure with you guys, and we're going to just kind of work on it together. First, we're going to ask the patient if they have anything in their mouth, like gum or candy, and if they do, we're going to ask them to remove it because that can affect our results. Because if someone's chewing on gum or candy, it's going to kind of look like they have abnormal movements going on, right? The current condition of the patient's teeth is also important, so we need to ask about that because if they have missing teeth or painful areas in the mouth, that's going to affect how they hold their mouth. We also need to ask about dentures because that's going to affect that as well. We're going to ask if the patient notices any abnormal movements of the face or mouth and how bothersome do they find it if they do have those movements. The patient's going to sit in a chair, and we're going to judge them at rest. We're going to see the movements of their hands and arms. We're going to see if their feet move when they're placed flat on the floor. We're also going to have the patient open his or her mouth. We're going to do it twice just so we can compare each time to be sure it's an accurate reading. And then we're going to have him or her protrude their tongue, and we're going to do that twice as well, just so we can get an accurate reading. Because if they, stick their tongue out once and it looks off, we want them to do it again just so we can make sure it was an actual, 4 instead of like a 2. The patient's going to tap each finger with their thumb like this, and they're going to do it with each hand, and that's just measuring the flexibility of the joints and the movement, making sure there's no rigidity there. And then we're going to have the patient flex and extend their arm. We're going to help them with this. So basically, when you see here, my arm, it moves pretty normally. A patient who's on antipsychotics or psychotropic medications, their arms might move something like this. They might kind of jerk like that and be really rigid. So that's called cogwheeling, and we do need to report that to the doctor because that is a side effect. The next thing we're going to do is we're going to have the patient stand up, and we're going to look at their entire body and see if they're having any abnormal movements or anything like that. Okay? Then we're going to ask them to extend their hand out like this so we can see if they have any odd movements with their hands. The last thing we're going to do is we're going to have the patient walk a few paces, turn around, and then walk back. We're going to observe hands and gait, and we're going to do this twice. And that's about it. That's about it with the AIMS scale. I have a couple questions for you guys to answer. Y'all can just write me a paragraph about answering these questions and bring it back to me tomorrow for class, and we can give extra points. Okay, so Mr. Smith is unresponsive to Risperdal, Zyprexa, and other antipsychotics. What medication would you expect the doctor to order? What lab tests would you expect him to order? Why? What are some other considerations regarding this medication? The next one is about Miss Jones. She's diagnosed as bipolar. She presents to the outpatient clinic complaining of swollen feet. How would you advise Miss Jones? So, that's it. Questions, comments, concerns? If you have anything, just let me know. I'll be happy to answer. And that's it. Thank you so much. I'll see you guys next time. Thanks.